Now, India has reported 2.4 lakh new COVID-19 cases.
देश में
India's
कोरोना से
registered
बहुत
कोविड की महामारी से
Rep-
पिछले साल जूझ रहे थे
வருகின்ற
अब हमारे
ஏழாம்
पास
தேதியுடன்
सेकंड
முழு
वेव
ஊரடங்கு நிறைவடைய இருக்கக்கூடிய தமிழகத்தில் மேலும் ஊராட்சி நீட்டிக்கலாமா அல்லது நீட்டிக்கலாமா என்பது குறித்து தமிழக முதலமைச்சர் மருத்துவ வல்லுநர்களுடன்
COVID Care Center, we've learnt this from both the first wave and the second wave, represents a critical intervention in infrastructure in the overall pandemic response. What it does is, for patients who may be sick enough to want to seek medical care, but who may not be so sick that they need to be at an ICU or at a hospital, can find a safe space where there are medical teams, there is access to oxygen, there is access to medications, there is access to appropriate nutrition and certain forms of social support.
So between COVID 1.0 and COVID 2.0, there has been one significant difference in that the unpredictability of the progression of the disease. Whether it is due to variants or it is due to a new category of patients getting infected. And third, very importantly, people being advised home isolation based on the previous year's experience and then the condition aggravating. So people who come to a COVID care center today are far more complex and unpredictable than in earlier days.
This COVID Care Center was an absolutely unique and extremely enriching experience, wherein two medical teams, one representing modern medicine, that is at PCMH Restored Health, and the other representing Ayurveda from Ayurveda hospitals, joined hands to put together one of India's first integrative care COVID care centers. This, I think, was not just a unique step forward, it was also indispensable, which allowed for us to keep the patient at the center of our thinking and our care processes. It allowed for the appropriate integration of both of the best in Ayurveda and in modern medicine.
We approach in a holistic manner where the physiotherapist, Ayurveda, allopathy and also counseling sessions takes place with the patients. And the other very important thing is we treat patients in a non-judgmental way, including from marginalized communities. The patients here who stays, they are like a family between them. They have no discrimination, where the transgender person has an opportunity to mingle with a lot of other communities.
The level of integration between the two sciences, Ayurveda and allopathy, is seemingly happening at a greater extent. Whatever the patient's health caters needs, we physicians jointly discuss and the best of our things are delivered to the patients. It could be ranging from multiple factors, from the disease point of view, which is COVID point of view, to the basic functional activities of life. So all these things have been addressed here at the COVID Care Center.
There was one case that I would want to mention wherein a patient had very high BP and we didn't know what we would do. Did we give allopathic medicine or something? And Dr. Rajesh stepped in and said there's one medication from the Ayurveda that actually, does, it's a after effect or a side effect of that medicine would be drop of BP. Could we use it? And that really was such a nice thing. When I saw that, the combination worked amazingly well with that particular patient. So this whole experience was definitely an eye-opener for me.
So with these two approaches that have been undertaken, what we are very glad to share is not just the ability to work together, right, or coping with each other, but rather quite the opposite, which is the sheer indispensability of working together. And I'm very confident that in the very near future, weeks to come, we'll be able to show very concrete data how this seamless integration works.